Okay, Liz? Yeah. Welcome to everybody to the Adult Services panel. If I can ask you all to introduce yourself, those that are here, so that's for the benefit of those online. I'll start. Councillor Sue Jones, convener of this board panel.
Liz Jordan, Scrutiny Officer.
Tony Member, independent member of the
Paxton Hood-Williams, Councillor for Fairwood.
Amy Hawkins, Head of Adult Services and Tackling Poverty.
Councillor Hayley Gwilym, Cabinet Member for Community Support.
Dave House, Director of Social Services.
Alan Jeffrey, Councillor Uplands Ward.
Thank you all. We go on to item 1, apologies. Liz?
Chair, we've received apologies from Councillor Chris Holly and Officers Helen St John and Kelly Gillings.
Thank you. Are there any others? Right, item 2, disclosures of interest. If there are any, Liz will email out templates for completion. Are there any disclosures of interest?
Yes, I've got a personal interest. I got a family member in receipt of social services.
Thank you, Jeff. Anybody else? No, fine. Item 3 is prohibition of whipped votes and declaration of party whips. Any comments? No. Minutes of the previous meeting, which was held on the 10th of September. We can go through page by page. Page 1. Page 2. Page 3. And page 4. Are there any comments? I have a support that the minutes are correct. Take your silence.
Yeah.
Thank you, Mark. Thank you. Item 5 is public questions, Liz. None? Going through this well. Item 6 is implementation of West Glamorgan Regional Partnership, Emotional Wellbeing and Mental Health Strategy. Who's leading on this item?
Katie, I assume, is it from the regional? Oh, sorry, Dave, I just you haven't said.
No, you're absolutely right, Councillor Gibbard. Yes, just to say, we haven't got Kelly Gillings here, but we've got Karen Stapleton, who's a colleague from the Health Board, who will introduce herself. She leads on this work stream within the regional partnership. We've also got Katie Kinnevane from our West Glamorgan transformation team, who's the transformation manager, who also supports this programme. So I'll hand over to them and they'll take us through the report, Chair.
Thank you, Dave. Right, which of you are leading on this now then?
I'm Karen.
Thank you, Karen. Over to you.
Hi, everyone. Lovely to be here today. I'm Karen Stapleton. I'm a Deputy Director of Strategy and Planning in Swansea Bay Health Board. As Dave said, I'm also the Chair of the Emotional Wellbeing and Mental Health Programme Board. So it gives me pleasure to come today to give you this update. I understand you would have had an update about a year ago on this, and Amy Hawkins is the Deputy Chair of this programme as well. A really important programme, and when you had the last update, we'd spent a lot of time consulting on the emotional wellbeing and mental health strategy that has been produced for the Swansea Bay, West Glamorgan region. So this covers Newport Talbot and Swansea local authority areas. A lot of work went into engaging on the development of the Swansea of the strategy, and in the last 6-7 months we've been starting the implementation of that. So I'm going to take it that you have read the detailed report that's been prepared. I'm just going to give you an update from page 9 onwards, really, which is what we've been doing and how we are taking forward 3 key elements of this strategy based on what the public, the third sector and leaders in the area of public emotional wellbeing mental health told us. So those 3 main areas they told us they wanted us to get on with doing. So one was about joining up services. So we're aware that there's huge pressures on mental health services, and the third sector providers plug a huge gap. What they told us is that they were struggling with joining up the different services. Funding that we give to them through the Regional Partnership Board and through the Health Board and other sources is short term. That doesn't help them with their planning and sustaining their services. So we heard that really clearly. And one of the things we want to do is to make sure we can help put that funding for our third sector, voluntary sector providers on a sustainable longer term basis. So we've been looking at different ways to fund the sector and looking at models across the UK where they're doing different ways that they're commissioning third sector services. So that's a key part of this programme. We're just starting on a journey to look at a different model to provide longer term funding. And we really recognise that demand for emotional wellbeing, mental health has really grown, particularly since COVID as well. So we're seeing waiting lists build up, and then that pressure is being felt then by our third sector providers. So we really need to get this right. We really need to understand what outcomes we want for our population and what we can do to sustain people and stop their anxiety, depression, worry escalating. And that's what we're trying to do with this part of the programme, is by looking at what our third sector providers are providing and putting that on a longer term basis. So that's a key part of one of our commissioning work streams. The second part of our work stream of our programme is to provide better access to current services. So the statutory sectors, so local authority, health board, we provide a number of services to people with emotional wellbeing and mental health. And we're aware from listening to what people are saying that people find it really confusing. They don't know what's out there. So one of the first things we felt was a really quick win we could do was to actually put all those services together in an easily accessible way. So professionals and the public, friends, families, carers could all access the range of provision that's going on out there. There's a huge amount going on to support people. So what we've done, and recently on World Mental Health Day, it was really good to be able to launch 2 websites, one called Sorted Supported, and that was for older people. It's a website that you can go and find all the supports available by one click. You can click on this website and it opens up and shows you all the providers. It gives you updates on anger management, depression, anxiety, all the support services are there. And we've got one of those places for called Tidy Minds for young people to access up to the age of 17, and then Sorted and Supported is a website for older people, adults. So that is a big step forward. Work on those websites has been going on for a number of years, and we're really pleased to say that funding through the Regional Partnership Board has helped make those things come to life. So we're hoping, whether you're sitting at home with your family or whether you're a GP or professional or nurse, you can use these to help know what's out there at the moment. So that's another key thing that we've been leading through this programme. Another part we want to do is to make sure that when people do access services, we can create a single point of access, so they don't have to go through lots of different doors, to some different waiting lists. So that's the next stage of this programme, is to see how we can actually, from a patient, person, citizen's perspective, you can access services, and behind that you get signposted to where you need to go. So that is the next step, and that means working with our local authority colleagues, working through the community mental health teams, working through the mental health teams in the health board, and working to sort of get that single point of access really working for our citizens. So that's not going to happen overnight, but that's the next stage of that part of our programme. And then the last bit of the programme, we knew that those first 2 parts of the programme is about making what we've got work better and making it more effective and more accessible. The third part of the programme was a theme about some of the gaps where we're not really getting quick access to people who are really sort of coming up with problems, and we're not, we don't want them just sitting on waiting lists. So the health board has employed and put some funding into developing community psychology. So we've employed 3 psychologists at the moment, and we're basing those in the GP clusters. This is where our GPs are already working together with their communities, with pharmacy, with dental, with optometry, with their cluster colleagues. So Cwm Tawey, Upper Avon and the Bay are the first ones where we put community psychologists who are working to really understand the social determinants and what's causing people in those communities to have underlying mental health and well-being problems. And as you'll appreciate, there's a lot of things that cause people to feel anxious and anxiety. So it could be they've been discriminated, it could be because of the poverty, it could be to do with their income, could be to do with education, the whole range of things that are causing people to feel anxious. So they're really starting to get underneath that and understand what it is we need to do in and with communities to help them work their way through this. So that's the next part of our programme. And some really exciting information and data is going to start to come from that, which we'll be able to use to shape where we need to go to support people. All this has been done with co-production. That's at the heart of what we do in the Regional Partnership Board. We've set up a regional, a virtual emotional wellbeing forum, so we can really get in touch with people who've got lived experience and really understand what we need to do. And on our programme board, we have a number of people who've got lived experience who've been working through this programme with us. I've mentioned the engagement we did to develop the strategy, the ongoing engagement we've done since we've finalised it to make sure we've got the right priorities. Yeah, we've run many engagement workshops, and it's the heart of what we do as well. So finally, then I think we have money that we have. So through the Regional Partnership Board, we have a regional investment fund. That's what we use to fund our third sector providers. We also have a mental health improvement fund that comes from Welsh Government, and we have money that the Health Board puts into commissioning mental health services. We are aiming to try and bring those three funds together to really make that money work better for us and really make sure we're addressing some of the gaps we've got in this area. So I think that was the main thing I wanted to get across today. I hope you've got a bit of a taste of the three areas we're taking forward. We're making progress, but this is a journey we're on for the next 5 years, really. So I'm really happy, Katie and I, to take any questions you might have. Thank you.
Thank you, Karen. Are there any questions?
On the hand button, haven't I? Is that working? Oh, wonderful. Thanks. Thanks, Karen. That was interesting. I wonder if you could just expand a little bit on the remit of the three psychologists. To the extent do they have each got a particular skill, a particular insight into a part of the service delivery, and which, when you put the three of them together, you end up getting a good team. And how does the psychology side of the business relate to, if it has to relate to, the psychiatric services of the hospitals and the community-based services of backup and support?
Okay. So what we are trying to do through this programme is move away from the medicalisation of people just going to their GP, being referred on maybe somewhere else, or put on medication, which appropriately is that happens where it's appropriate. But we know that's not what people want. And the feedback we had is that people don't want that. They want, first of all, people look to their families for support when they're not feeling right. Then the next level is they maybe go to their GP. What we're trying to develop with the community psychology model is a well-being model. This is very different. This is not how we work at the moment, particularly in health. We medicalise people. So community psychologists, they're three of them have been employed at the moment, and they only started recently. So the last one's literally may even been interviewed this week, sort of thing. So there's two in place already in the Bay and in Cwm Tawi. We put them in the Cwm Tawi cluster originally because they've got a well-established setup in the Cwm Tawi where they're doing lots of things with their population already around mental health and emotional support. So the three psychologists, it's early days, and we're having a presentation actually at the programme board that possibly Dave will be chairing next week, where my work programme reports into. We're having one of the psychologists come to talk to us about what she's already starting to uncover. So it's early days in terms of what they're doing, but we haven't just plucked this model out of thin air. We're working on a model that's been well established and embedded in Gwent. And we've had many presentations from them on what this approach to working in and with communities will do, and getting communities to support themselves and not just doing things to community. So it's a very different approach to the medical model that we're currently working in. And I think it might be that we come back and bring some of our colleagues with you with us in future to present some of the findings, which is very early days. So hope that gives you a bit of a flavour. They will be working together, the psychologists, but they're working with the communities, which is really important. And each community will be different. You know, the Bay community is very different to the Cwmtari communities. I know you'll be aware. Hope that helps.
Thank you, Karen. All right, Tony.
Thanks, Claire. Can I just come back on a bit of it? In terms of when you went out to seek the skills, did you deliberately advertise the jobs in different ways, so you ended up with 3 skills that you were searching for, or did you pick the best of what happened to come forward in terms of their particular interests? I wasn't quite sure which bit of that equation we were looking at.
Yeah, I wasn't involved directly in the recruitment, but there would have been a clear job description with requirements. These people are psychologists; they have a psychology qualification. They may be they're qualified in certain areas, but these are they're qualified people who have gone through a degree and would have what you need to do. And they will have probably had some work they're already doing in these areas as well, where they're working in the sort of well-being, social intervention sort of side of things as well.
Thank you, Karen. Councillor Tribe, you have a question?
Thank you, Susan. Karen, sounds like an excellent initiative and definitely a step in the right direction. Any idea when these useful contacts, numbers, points, whatever, will be publicised and sent to individual councillors? Thank you.
Okay, I might bring my colleague Katie in with that. So I know there's a team in both local authority areas. There's a contact who are out there trying to get the website socialised and get this out there. So Katie, can you come in and help me there, please?
Certainly, yes. Yes, so at the World Mental Health Day, which was, I believe, on the 10th of October, the websites were launched officially during an event that was facilitated by Health Board at the Waterfront Museum in Swansea. So we have funding going into the Swansea CVS organisation, where we have a lady called Rochenda who is now on board, and it's her responsibility to now promote and share these websites, to publicise them, and there is a communications plan written up where she's going to take that around different organisations and make sure that those sites are available and promoted for use, and also continue to develop them, because of course as professionals are using them and as members of the public are using them, there may be things in those websites that are missing that we haven't thought of. There may be areas that we can improve and expand on. So it will be Rochenda's role working with CVS in Swansea and linking back into the regional partnership to make sure that these platforms aren't just sort of produced and then put out there into the ether and left. It's constant monitoring of the usage of those sites, which pages are more popular, how often people access them, to see which areas of that platform may need perhaps expanding, more information, and so it's been launched, but it isn't been launched in its entirety. That will grow and develop as the programme continues to be implemented and as we start to learn what the population need, where they're going for information. And with that access to service workstream, that second workstream Karen talked about as well, that will also be looking at a lot of the data across the region, looking at a lot of the information that we're learning about the population from social care, from healthcare, and from third sector. And we want to have that two-way. So we're sharing information with the public, but we need to get information back on where the gaps are, what people need, how people need it. And an example of that is in a lot of the engagement that we've done, people tell us that the second they have an issue with their mental health and they decide that they need to reach out for help, they'll phone their GP and they'll reach out to their GP in the first instance. And that seems to be the most popular method at the moment. The experience people have in that is very mixed. Some people get signposted in, straight away or referred straight away into the right help, the appropriate help that they need, and other people get medicalised and get a prescription for antidepressants. So there's a lot of work to be done around raising awareness, engagement, sharing with the public where they can go for help, but then also listening to where they want to go for help and making sure that those front doors are prepared for that. So again, it's early stages around the implementation around that, but that's going to be an ongoing iterative process.
Smashing. Thanks very much.
Thank you, Katie. Okay, Mark. Councillor Jeff Jones. Oh, sorry. Councillor Jeff Jones, you have a question?
Yes, it's, well, not a question, but a comment. I thought the report was good. I thought the you actually said you started from page 8 or whatever. I thought the previous pages, I think 5, 6 and 7 were, it summed everything up with regards to you know, feedback from the public, voluntary and senior managers. I think it captures actually what's, shall we say, what's wrong and the areas that need to be tackled. Going on from I think what Katie actually said then about signposting. You know, I'm not an expert in mental health and so on, but what I've perhaps found from not personal experience is really, you know, the signposting problem. People are not signposted, or not, the illness is not properly identified at an early stage. I don't know if it's down to lack of resource. I assume mental health is an extremely complex area. It's not like somebody perhaps has got a broken leg or whatever. I'm not trying to demean other parts of medicine, but really it's the importance of the signposting and the resource to actually take up the problem further down the line. You know, at the moment, that seems to be a big problem. These psychologists, are they going to, well, I don't know what they're going to do really with regards to, but are they going to tackle or look at that particular issue of signposting?
I'll pick that up, Katie, thanks. So I suppose what's been really clear is that at the moment, there's not many routes to go. So and provision depends on where you live as well. So I talked about the Cwmtawi cluster as an example. So what we're finding is that some GP practices and GP clusters are, because they know that what their patient citizens need, they don't need to be put on medication. They just need some help to work through their particular problem. So they might need a bit of therapy, they might need a bit of analysis, but they can't get that because to get into the NHS, some of the waiting list criteria is a bit higher than that. So there's nothing, people are falling into this gap, you know, in between. So what we're seeing is the third sector are popping up and picking up some of that gap. So we've got a range of providers. They might be housing providers in the area, and they're actually picking up that some of their clients have got some of these needs that need sort of support. They can't deal with them, so they're taking on some sort of therapeutic support to help people work through, whether they're young people or people using drugs, for example. And then we're finding GPs are doing something similar. So, but what we've got then is inequity and not good access across the region. So we recognise that what we've got now is not right. And what we're trying to do is build that layer, I suppose, before you need to go and get yourself medicalised or into a community mental health team where appropriately you need to be. We're trying to build that well-being model, well-being service, which is something we have not got that at the moment. We haven't got something that helps people with their well-being. They're not ill, you know, they just need support and help. So that's what we're trying to create. And we've got a clinical lead that started as part of our programme, and she is a psychologist as well. And she's going to be working with us to develop a framework for what well-being looks like and what well-being means. And that's going to help us then get, if you like, that tier of provision before you need to hit the proper health services. We're going to start to look, what does that mean for Swansea and Port Talbot? It'll be a mixture of services that the third sector can provide for us, but also the community psychologists are going to be working with communities, with groups already established, with because there's a lot going on in communities, as you will already know. And actually, if people are working through a wellbeing framework and model and knowing where to signpost people, we're starting to build that real strength in communities, I suppose. And that's going to be, that's what we're trying to build. I don't know whether I'm articulating it properly for you, but that's what we're trying to build by a different way of doing things here. And I think, you know, we need to almost come back and show you how we take you on that journey of how we're trying to build that sort of different way for people. I don't know if that's helped, Councillor.
Yes, it did actually. And you mentioned this, signposting. I still see that as a really important. That people are signposted to the right, shall we say, section or whatever. That they're actually treated with the right. What I've got to say, resource at the end of the day. Actually going on as well with regards to, you mentioned budget provision as well. This, and you mentioned this is a growing area because of COVID. I assume drugs plays a big part of this as well. You mentioned, different areas of funding. People are cash strapped. I don't know what's going to happen in the budget tomorrow and so on. But really, are you going to, I think there's been short-term budgeting or provision, really, you mentioned in the report. So is this going to be budget provision on a longer term, for a longer term?
Yes, that's absolutely what we're planning. So I mentioned earlier, there's 3 pots of money, or possibly 4, that we have, I suppose, to play with in this area. So the regional partnership board has regional integration funds, and we're putting money into mental health, early intervention, support, emotional well-being. The directors, Dave and Andrew in Newport Talbot, and my director in Swansea, they recognise that what we're putting into this area of from our money is maybe not enough. So they've said, we want to put an extra 500,000 if we can into this area. So that money is already going to be coming to our programme. So that's additional money that we recognise we're putting in. So the health board has got money as well. We've got the regional integration fund, and then we have mental health improvement monies that come from Welsh Government. We want to align all those together and really make sure that is working and we're not duplicating things. We also have GPs, so I mentioned earlier, they are commissioning in some areas their own money to support people with emotional well-being. GPs have been part of our journey with us as well, and some of those are saying, well, when we know what you're doing, we might put our money into the pot as well. So really are trying to put that money and make it, so rather than commission yearly, as we do at the moment, some of the third sector, we want to do that on a 3 to 5 year basis. So that's what we're working to do, to give the third sector longer term contracts, so they know year to year that they can guarantee that money. But we need to make sure we're getting that provision right, don't we? And the third sector have got a big part. We've got the big players like Mind. We've got smaller, much smaller things. Like I went to see something last week where Kate and I went to see a small provision up in the woods where they're looking at children and carers and taking them out and giving them a bit of support and emotional well-being over the summer holidays. That's a tiny thing compared to then, a big organisation like Mind. So we've got a whole range of things that we're looking at to help plug some of the gaps, but we want to get that right going forward. So it's definitely about longer term sustainability and hopefully a little bit extra investment in the sector as well.
Okay, thank you.
Thank you. And just a comment, really. I get told all the time access to GPs is horrendous. I hope that will be improved in order for this to actually go forward. Thank you very much. Anybody else want any comment on?
If I can, Chair, yeah.
Yes, Alan.
Well, yes, a comment or an observation rather than a question. I noticed that the statements on page 7 and 8, I think, is it item 1.12, gives an indication or a realization as to what is not working well or ideal in terms of addressing the needs of the public with respect to well-being and mental health. So do we assume then, and I hear what you say, and thank you, Karen, for the presentation, that item 3, I think, on page 9, is telling us that work is in progress or under review to address what has been identified as a shortfall or a not satisfactory working strategy in identifying the priorities to change the way people access the mental health services. And, are there any sort of practical evidences of this to say that the strategy is working for the public?
I would say it's probably a little bit earlier to say that it's working yet, but I hope that what we showed you today is that we heard what people said, and then we almost played that back then. This time last year we held 3 engagement workshops, 2 before Christmas, 1 after Christmas, and we said, look, so this is the strategy, this is what we heard in the strategy. We played it back then to a number of sessions saying, so this is where we think we need to go and prioritise now. So we need to start with these few things and work this up over the next 5 years. So the things that we've focused on today are the things that we think are going to address what we, so for example, getting that information out there, getting that signposting, getting that website out there, and making sure people know what's there. That's one of the first easy things we can do. Then we need to develop what we're calling these anchor structures, in communities, which is often around the GPs and their practices. It could be around rugby clubs, it could be around churches, and that's why we've got the community psychologists working in communities with what's important to them, because they'll be quite different up in the Avon Valley to down in Port Talbot, won't it? So I think we heard what people said, but I wouldn't say that we're there yet. We're definitely on a journey to start to do this, and these are the areas we're focusing on to start with.
Yeah, thank you, Karen. Yeah, I can see it's a big job that you're taking on board, and I can appreciate the fact that it's going to take you several years, to sort of put it right. Diolch yn fawr. Thank you.
Thank you, Alan. Paxton, you have a question?
Thank you, Chairman. I'm probably going to show my ignorance at the moment, so I'll apologise for that in advance if that is the case. But I'm looking and seeing that you're talking about having about 9 clusters, as I understand it, across the whole area. That means a population average somewhere, I suppose, about 50,000. Are you looking at 1 psychologist for 50,000 people? Is that what you're looking at in that respect? And I'm not quite sure you define community psychologists in this respect, in the sense that obviously you'll have communities within those clusters, separate communities. So I assume you mean by a community psychologist means somebody working across those communities rather than in one specific community. As I said, it's going to be a stupid question, but perhaps I'd be able to clarify that for me, please.
No, it's not a stupid question at all. No, I think what's clear is that what means a community, it means different things, different people, doesn't it? So I think the health board has some of the structures that we've got are the GP and the clusters, and they're what they've set up around them. So we have as a mechanism to get the initial psychologists out into the community, we have used the cluster anchor point, I suppose, as our basis to do that, because they are already in the communities dealing with people, as I said to you before, sometimes employing their own therapists to help support the population that are accessing the GP. So that is where we started. So we've only got those 3 now. At the health board, like all of us, we are strapped for cash. We're on a huge deficit position. So we've got 3 now, and I think we've got the last one we're applying now. That's the commitment we've made initially. We put like £1 million into this. Working, we'll be looking at really closely about how we roll that model out going forward. Because you're quite right, it might not be that is the structure for each community, because they are all different. So we are at the start of this, but we have linked the initial ones to the, I suppose, the health service structure that we've got, I suppose, in place, which is already embedded in the emotional wellbeing mental health agenda.
Thank you.
Thank you, Karen. Katie, you wanted to come in on that?
Yes, please. Just to add to that, the community psychologists will start working with the community, the clusters, the communities within the clusters that they're working with, and understanding the issues, the challenges that are facing each community. And as Karen said, community is different, and different communities will face different challenges. And I think that the longer term view of the community psychologists is that where similar issues are being unearthed in a number of clusters, there will be a joined up piece of work then to address those common issues, that commonality, and then there will be more tailored, specific pieces of work that go to issues that perhaps are standalone to one individual cluster. So yes, there are going to be 9 clusters, that there will be community psychologists working within those footprints, but they'll also be part of a team led up by Zoe, as the clinical psychologist who's just started with the programme, and they will be connecting all the information that they're learning and developing solutions in a joined up way. So you won't get 2 or 3 community psychologists working sort of in contradiction of each other. Everything will be joined up and will flow together. And as I said, where there's those regional problems, they will be addressed in a regional way, focusing then sort of resources on targeting specific issues in communities that are standalone to that community. And an example of that would be, the implications of Tata Steel closing. That isn't just being felt by one cluster in the region. That's being felt by people across the region, because of course people across the region have been employed at Tata Steel. So it's things like that. The community psychologists will remain in a team and working together very closely. So I hope that gives some more flavour to the answer.
Thank you, Katie.
Yeah.
Thank you. Are you happy? Thank you for your presentation. Perhaps we could invite you back on progress. Karen, do you want to say something at the end?
I'm only going to come in on the back of what Kate said to say that I think it's really important to get across the community psychologists. They're not holding caseloads of patients. So the approach they're taking here, Katie's described really well, is that they're working with communities, identifying issues that are causing worry and angst and in communities, and then trying to work with them on solving those solutions. So it's quite a different approach. So we'd really welcome Councillor coming back and giving you an update and keeping you updated on this programme if you'd like that.
Thank you both.
Can I just put on record my thanks, Chair, to the regional team and to Karen and her colleagues, and to Amy and her colleagues in adult services as well, because it's really important, this partnership approach, to make this really important issue, to move it forward. So grateful to everyone working on this.
Thank you, Louise. Thank you all. Very interesting. Right, we go on to item 7, which is local area coordination update. I'm not certain, Hayley, you're leading on this here. Lovely, thank you.
Yes, thank you, Chair. This is our second welcome back to Scrutiny to look at local area coordination and the impact that it's having across Swansea. It's the second impact report prepared by the team. The subtitle, I think, says it all: supporting people to stay strong through family, friends and community. This definitely shone throughout the report, and there has been a commitment by this authority to continue with local area coordination, and for it to be a fundamental part of our early intervention and prevention offer within adult services, with coordinators embedded across our communities across the city, which is evidenced, I think, by quotes such as, "This coordinator plays an integral part within our community." The coordinators have been truly key connections in the lives of our residents, the people that they are supporting, them themselves often being the resource, giving people the confidence, as was quoted, or by bringing other services in at the right time for those people. An example, again, is a quote saying, "Seeing how people respond to him, and he's motivated me to turn up," and that's from Dance to Health. Our coordinators really are having a life-changing impact. Some more quotes, which I think are testament to this, are, "Life gets better with this coordinator." Another coordinator being described as a lifesaver, and one coordinator being thanked for stopping me doing something stupid. I think this is incredibly powerful. And another being credited by somebody saying, "I can feel my soul come back to me." Coordinators work collaboratively and in partnership with other council departments, partner agencies, and of course us as councillors. They work in with approximately 50 to 65 residents at one time, along with supporting local groups. Throughout the year, 1,101 new people were introduced to local area coordination. And the pie chart shows the wide-ranging organisations and departments that those referrals have come from, which I think clearly shows how well known local area coordination is. 28 new groups have been established, which means that even more people will get to form new friendships, new connections, support networks, and building even more resilience within our communities. 2 separate studies university studies have been undertaken which provided definitive evidence that this approach to intervention works, and also that it is also very cost effective. I think the quote was 2 to 3, isn't it, for every pound that's spent. Our local area coordination team are a massive asset to the local authority. They are well thought of not only in our communities but across other local authorities, and we are envied by many across Wales. They were also winners of the Wales Inaugural Safer Communities 2023 award in the Equalities, Inclusion and Cohesion category, which is testament to the exceptional work of the team. I think I call them mini lifesavers, mini superheroes going across the city of Swansea. Not to say that there are no pressures, as with most areas of public services. There was a restructure at the start of the financial year, so the number of coordinators did reduce. However, full county coverage was retained. Demand continues to increase, and there are always workforce pressures with staff sickness. However, the team have set up a generic email address to ensure that referrals, contacts will not be missed and people are not left without support in the absence of a designated coordinator. And I know that Lee Campbell shared this with us as councillors, and I know that it's been sent out to partner organisations as well, and I would encourage this to be shared amongst everybody else's networks as well. So if I can just say local.areacoordination@swansea.gov.uk. Yeah, if that could be used for any future contacts, that would be great. I don't know if I missed anything or if Amy wants to add anything in. Thank you.
Can I, yeah, just only a couple of things. I had a list and I've crossed off nearly everything. It's good. It's good. I wanted to just highlight on page 9, we demonstrate outcomes that people have achieved in that self-reporting way. Individuals have told us, and they look like the spider webs. It's that page, and I think it's just interesting to, just the evidence that people are telling us in terms of the outcomes they're achieving, and showing where they were before the intervention with area coordination or the involvement, and then afterwards. So people are reporting they're feeling more control of their life, that they feel part of their community, they feel confident about their future. So I also wanted to highlight, very much building on what Karen and Katie were telling us about the previous piece of work, the mental health strategy. Area coordination is highlighted in the mental health strategy. The community psychologists have linked up when they're doing that community mapping. So this isn't in isolation. I suppose I just wanted to highlight that. And then I just wanted to particularly highlight 2 more sections. The partner organisations, I think there's some examples in there which are very interesting. I mean, Hayley's quoted some comments from partners, but I think there's an interesting article there from one of the health board clusters that we spoke about, or one of the GP clusters. And then also the video stories, there's links that should work from your link, even though it's PDF, and those links to 3 video stories as well that you might be interested in seeing. Thank you.
Thank you, Amy. Are there any questions?
Okay.
Nobody. Oh, Alan.
Yeah, if I can just make a comment, certainly Hayley did answer a lot of questions. Suffice for me to say, I fully concur with what you say. I think I'll leave it at that way. But I was just concerned about, or a concern that has been given to me, and this is not a whinge from the LACs, but I work with 2 LACs weekly, or they work with me. I don't know which way around it is, but I do, and we meet each other a couple of times a week. But the fact it's been reduced from 23 to 20, I think that was the figure, and therefore there's been an increased workload. They are saying that they're concerned about the workload that they got. That's increased. And whilst they're not sort of whinging about the fact that they've got the work, they're just concerned about the fact that they can't get around to the people who are in need because they don't have the time. Basically, it seems to be very stretched. I just thought I'd raise that on their behalf, but I will emphasize they're certainly not whinging about the fact that they've got a lot of work. Their concern is, with the people they interact with. Okay, thank you, Chair.
Yeah, I could reinforce that because it takes me longer to get through to my coordinator now since her role has been expanded to a different area, slightly area. So yes, I can understand what Alan is saying. Right, Paxton.
I think the point that Alan's making is well made, in fact, in terms of the fact that we lost a couple of coordinators next year. You will already know that you're beginning to look very closely at your budgets ahead for next year at this point in time, getting ready for the budget in March. Are you confident that you'll be able to retain the same number of coordinators as you have now?
I think that's a real challenge, and part of it again goes back to what Karen described around we are managing on short-term funding, and it's particularly impacting on third sector, disproportionately impacts on third sector, but it also impacts on the council. A lot of the reason that we lost capacity in this past year is that grants that still continued were flat grants. Well, inevitably, that hasn't then been able to suck up the range of inflationary pressures. That's still in the system for the coming year. That puts council in a difficult position around its own budget setting processes, because it's not in control of some of those things. And we are still heavily reliant on a variety of grants. We're very good at being imaginative as a council, and finding ways of of plugging gaps where we can, but it's an extremely pressured position. So we all wait with bated breath as to what is going to, what important decisions are going to be made over the next few weeks in terms of investment in public services. I think the statements that the Cabinet member made about that we all recognise this is a real priority, and it absolutely features in that mental health strategy. So it doesn't make sense for us to be disinvesting from the things that we know will make a difference and in the end pay for themselves. But it doesn't help you when you're juggling short-term pressures, short-term overspends, significant inflation in the system, and a contraction in public service funding. In the end, the solution is the one that Karen pointed to. How do we find a way of pooling all of these different sources together across the region, across public service organisations, and then make choices? If we make choices then about we need some of this anchor infrastructure that Karen referenced, of which LAC is a really, really good example, then we might be able to put it on a sustainable, or certainly more likely to be able to put it on a sustainable footing. It's really difficult for the council to do that on its own. It needs to be in partnership. And at the moment, there's a huge number of competing priorities. Karen referenced very candidly the financial position of the health boards, starting from a significant overspend position. This council has drawn on reserves this year to cover its social care obligations to absolutely astronomically unprecedented levels. As I fed back to council when I presented recently, they are challenges that are in the mix. There's no point pretending they're not. Scrutiny will get an opportunity, won't they? The same as they do every year, to scrutinise those budget proposals. I suspect at that point you'll be looking at the, at the fine print to say what's the implications of this for things like LAC, not just LAC, but things that are in this prevention well-being space that LAC really is. How's that?
Any other questions? Anybody got any other questions?
Yeah, I got one. So, yeah, I don't want to leave at this point, about, budget provision and so on, but, it is an important part. Undoubtedly, the LACs have been a great success. But can I ask, what sort of provision is there in other authorities in Wales, and has this actually gone into England as well? And if it's, well, not if it's such, because it's such a success, are the Welsh Government aware of how successful and how important this area is?
Shall I come in on that? Yeah, it's in a number of councils in England. Derby, I can remember off the top of my head. I'll remember some others as we're talking, but we're a member of the local area coordination network. So we link up online and remotely with these other councils and share the best practice because it's based on an international model as well. Across Wales, we were the first area to have total coverage in terms of area coordination. Oh, thank you. Derby, Swansea, York, and Leicestershire were particularly involved in the evaluation that was done by Hull University. So we did that compare and contrast with other area coordination areas. But yeah, in Wales, we were the first area to have full county coverage. I know a number of councils are looking into this. I don't know if members remember, but we did a session with the Senedd in 2022, I think it was in this time of year in 2022, around area coordination, promoting it to other local authorities across Wales as well, and talking about what we've done. Sorry, promoting is probably the wrong word, but sharing what we've done. Neath Port Talbot have area coordination, as do Bridgend, but they run it in slightly different ways. So their model is slightly different, but they have members of staff based in communities working with communities to build their strengths.
Thank you, Amy.
I'd hate them to end up as victims of their own success, actually.
Yeah. Their preventative work is so needed in the communities. The confidence they give to individuals is unbelievable. They are a very, very vital part of the community. Okay, and we'll go on to the next item then, which is the performance monitoring. Amy, are you? Sorry?
I think Councillor Gibbard will introduce the report, I think, is it? Or
Yeah, sorry.
Is it mine?
Sorry, I didn't realise. No, I'm happy, as it's hard when I'm not in the room. Absolutely happy for Amy to take us through it. Just wanted to point out it's August's a report, so obviously a couple of months back now, but yeah, and hopefully in coming months, as we reported last time, the new social work restructure has been put in place, so we'll be able to kind of have some shows how that's kind of coming into effect in the next progress report. So I'll hand over to Amy.
Thanks, Louise.
Good, thank you. Okay, so in the report, it's quite a long report, even though we call it our summary. That indicates, I suppose, how much activity there is in adult services. This is just to try and give you a flavour. So in our front door, in the common access point, we saw a drop in referrals in August. This is to be expected because of the holiday period. But what I will say is that what we're pleased to report is there's 34% of those new referrals that came into us were provided information, advice, assistance and early help and didn't go into the managed care bit of the world, which from a previous average of around 20%. So we're starting to see our real focus around early help and prevention paying off there. A number of our referrals went through to our multidisciplinary teams, and the following pages tell you what they did. And again, that team supported people with early help, so they didn't go through to the social work teams. The number of new referrals we did have, though, we are finding that a large majority of them are still for people who want care at home, so domiciliary care, and that's reflected later on in the report. Going through to the assessment work that the social work teams have done, you asked us previously as the scrutiny panel to give us, for us to report to you, some information around the waiting list. So you'll see that's now in the report. So I particularly wanted to highlight those. So we've got a waiting list of 362 people who are waiting for an assessment. That is high. It's higher than we'd like, but I would say we completed 337 in a month. So it's just more than a month's equivalent of waiting list. But of course, we get the new demands coming in the door. So we need to reduce that. Some of that is that strategy at the front door to provide early help, but also it's around getting on top of these waiting lists. The restructure that we've referenced went live mid-September, and we're already seeing some benefits there. So again, I'll look forward to reporting that in future months, being an improvement on that waiting list. We do RAG rate that, so we do red, amber, green it to make sure and deal with those most urgent. So it's not always an exact month that people are waiting. Of course, we're looking at their different needs. what did I want to say here? Yeah, the reviews. So telling you about the reviews, again, we've told you about the waiting lists in reviews. We are seeing an improvement in terms of those. Around 75% of our, or not around, 75% of our clients in community social work, so that's the mental health teams, the community social work teams, the long-term social work teams, and the hospital social work teams are 75% of those cases, people with a care and support plan, they've been reviewed within a year. So 25 haven't, and we obviously want to get to a target of 100% there. So we're on 75% at the moment. That is an improvement in the last few months. So we've really focused on that. In mental health in August, that was 86%. So we're seeing mental health clients have a care and treatment plan. So it's a slightly different plan. 68% of carers were in date with their care and support plans. So it's an area to improve on, but it has improved. The waiting list for carers assessments have reduced as well, although it's still higher than we'd like. Going on to some of the other things that we've always told you about, we haven't sort of changed the detail in the report, but around our residential reablement, we're still seeing a number of people returning home independently, although as Helen and I have both said before, the acuity of people coming to us is just higher. I think people are just requiring longer to recover when they come to us rather than entering straight into reablement, and the same as people in community reablement as well. But we supported 59% of people in community reablement to not have any ongoing care. So, and some people who had care were smaller packages of care. The number of people in receipt of dom care has increased. So as I said, in the front door, people are coming to us in terms of dom care, but the actual packages of care themselves, we've got nearly 1,100 people in the private or in our commission sector receiving dom care. We're providing care with the internal services, both bridging and reablement, of over 100 people as well. So there's a large number of people in receipt of dom care. That matches the hours as well. So there's over 42,000 hours of dom care delivered a week. That is expensive. I think I was going to try and say another way of putting it, but it's increasing our costs. I think it's fair to say. But all this demand is, and it is helping people to remain independent. So, with it or stay at home for longer. So that's certainly in terms of what we want to do. But the numbers are high. There's no getting away from that. The day services, we're seeing a reasonably consistent numbers of people in day services, so we're pleased to report that. So in fact, slightly higher in August, although slightly reduced sessions. That again is due to the holiday period, and the bank holiday in August as well. The dom care, direct payments, we've got slightly reduced number of recipients, only ever so slightly. I think it was just 2 over the both adults and children. But we're seeing a higher number of individual payments. This can sometimes be, particularly in August, because people might have had a payment in lieu of respite or as well as their normal care costs. So there's different. It's a seasonal. We're expected to have that increase. What I want to tell you, the number of people waiting for dom care, I've put this a bit out of order on my notes, sorry. We've got between 50 and 60 people on our waiting list for dom care. So even though the demand is really high, the market is reasonably stable at the moment. Our providers are able to pick up those packages of care, which is very positive. In terms of safeguarding, we had a high number of adult risk reports really for August. I think it's fair to say we're not too concerned about it. We will track it, but we're still providing a large number of consultations. So I think it's just showing that the demand's quite high. The determinations took a little bit longer to complete than we would have liked. 73% were responded to within 7 days. Again, please be reassured. I have said this before, but I always think those figures make it look like nothing's happened in 7 days. Things are happening. It's just not concluded within the 7 days. In terms of safeguarding, and with our DOLS, our deprivation and liberty safeguards, we are seeing a really high number. Again, some of this has been to do with staff sickness and leave in August, but we're also putting some strategies in place in terms of how to manage this. Again, not unexpected because there are more placements, so more people in residential care, more people in supported living. So we are seeing more people requiring those DOLS to be in place. But as I said, plans in place. You won't see that coming down for a couple of months, but we will see it coming down.
Thank you, Amy. Are there any questions for Amy? I know, wow. Dave. Dave first and then you. Paxton then.
You put your mic on.
Mic on.
Page 65, just a matter of interest, number of brokerage referrals dropped quite dramatically. Does that mean that there's better capacity within the private system?
Yep. Yeah, it has been all year actually. Sorry, not all year. The last few months we've seen a real focus on that.
Okay, that's good then, isn't it?
Yeah.
It's nice to have something positive.
And it's even lower now, I believe, as well, isn't it? If that's not jumping the gun, I'm allowed to say that. Even.
Yeah, no, absolutely. We had our September results yesterday, so obviously you can't have them yet. It was too soon to get the committee papers out, but yeah, they've reduced again.
Good. Okay. Anybody else got any questions? If not, Dave.
Yeah, I'll comment on that first before I come to the bit that I was going to comment on. Just to put that in context, that there'll always be a waiting list for brokerage. And in fact, the system doesn't work if you don't have some sort of waiting list, because otherwise providers won't have business coming to them in a kind of steady flow. And that's a really good figure. Historically in Swansea, for years and years and years, that waiting list would have been steady at about 120. So it's less than half of that. That's really good in the context. When we came out of COVID, I was coming to this meeting reporting that we were going 200, 250 up towards 300. The team working with partners, in commission sector, have worked absolute wonders. I'll bring it back to, but it all costs money. That's still a real challenge, but it's our responsibility as a council to provide that care and support. So it is really good news. It's great that Paxton picked up on it. I just wanted to, something popped into my email box that I wanted to read out. It arrived just before scrutiny, and it's refers to a couple of things that Amy touched on around that remodelling of our front door, despite the pressures, making sure we've got a more preventive approach. Part of that preventive approach is sometimes we need to respond very intensively, very quickly, and we struggle to do it. But when we do it well, that's part of our preventive offer. I think Amy talked about it as the MDT referrals or something like that, but it's rapid response. I just wanted to read something that somebody sent to me. I will use their names. I feel compelled to write to you in praise of Benita and the other members of the rapid response team I've encountered over the last day. I went to medical school at the Mount Sinai School of Medicine, Mount Sinai Medical Center in New York City. It's a medical facility that prides itself on being one of the top tier providers of rapid response healthcare in the USA. Over the past 24 hours, Benita and other members of the team, Cameron from occupational therapy, Rob and James in physio, and Sarah and Natasha from home care, have more than equalled anything I encountered in my years at Mount Sinai. Their professionality, knowledge, skill, compassion, and of course rapid response to my family's emergent situation has been nothing short of world-class and exemplary. Specialised patient care at its very best. I think that's extraordinary.
That's brilliant. Absolutely brilliant. I think we're all gobsmacked. Yeah, thank you. Tony.
Yeah. Would it break any rules if that letter were included in the minutes of the meeting?
That's fine. I will send it on.
Thank you. Are there any other questions for Amy, Dave, or Louise? No, fine. Can I thank you all for attending? Oh, we've got a work plan item 9. Please make your move, yeah? Those the councillors to say back for the work plan. Can you pass our thanks on to those members of staff, because that was brilliant. Okay, you've all had a chance to look at the work plan. Item 9. Anybody have any comments? Yes.
Can for a minute or something, because it sounds today, isn't it?
11th of December, not the 11th of November. No, no worries, out before you said. No worries, because we're inviting child and family to that one as well. Yeah, the joint one. Yeah, thanks, Hugh.
We'll look at the complaints report together.
Yeah, yeah. All right. You happy with that? Yeah. With that, then I'll close the meeting and thank everybody for attending. Thank you all so much.
Thank you, and apologies again, I'm not in the room. Thank you.
No worries.